Good evening, everyone. Thank you for joining us for this AAHS webinar. This is part of our practice series. And today we're going to be discussing about building your brand in hand surgery. We have a stellar panel with us today, in addition to excellent leadership from our directors, Dr. Jane, Dr. Hammert. I'm Sahi Dendaluri, hand surgeon in Loyola. I'm one of the webinar directors, and I lead the practice series here. Today, we're going to have five great speakers presenting, beginning with Dr. Franco, hand surgeon extraordinaire in San Leandro, California, and one of my first forays into a community hand surgeon who learned how to build a practice and has done a lot to teach other surgeons how to do that. Then we have Dr. Badia, a shoulder to hand expert from Miami, who will be discussing with us how to build a referral base. Next up is Dr. Niedermeyer, one of my fellow alumnuses from Ortho Carolina, who's in Arlington, Texas. He'll be talking to us about advertising and marketing strategies. Then we have Dr. London from University of Missouri, who'll be discussing how to solicit and manage patient reviews. Dr. Galvez was one of my chief residents when I was an intern in residency. And has been one of my mentors. He will be discussing how to create a social media presence. He's a pediatric hand surgeon in Madera, California. And then Dr. Franco will be discussing any questions that may come up. Please remember to put any questions in the chat window. We'll be answering accordingly. And then we'll have some time at the end to answer some questions as they come up. So thank you all again. And Dr. Franco, I turn it over to you.
This is great. Well, this is a fantastic topic with extraordinary speakers. And we have about 10 minutes per speaker / topic. But if we can keep it down to 7 or 8 minutes, I'd be happy to include a couple of questions after each presentation. If you do have a question, please feel free to use the chat. You can send it to everyone or you can send it directly to me. And since I assume the speakers will be more focused on their slides, I'll take responsibility for bringing up those questions when appropriate. And if we don't have time, we'll just get to it in the Q&A at the end. So without further ado, Alejandro, why don't you take it away?
Thank you. Thank you, Aaron. All right, let's go here. Okay, so thank you for the invitation, and my charge has been to give some pointers on referral base within your community. Okay, here are my disclosures. Is that traveling or no? Did the slide advance?
Slide.
Yeah. Hold on. Okay, let's see. Okay, is that better?
We see the presenter view. If there's a way to swap it.
Yeah. Or I'll just do this. Is that, see that fine?
That'll work.
Yeah. Okay. So here are my disclosures. So how do you define your community? We traditionally think of this as your own town or your catchment area, and how willing patients are to drive a certain distance. Now people often can fly depending on what the pathology is, and then I also think that your community may be patients with particular pathology that you have expertise or interest in, and those patients who may be interested in your particular approach, which leads to some of the methodologies I'll discuss later to educate those patients about that. traveling has obviously changed, right? From I trained at Bellevue. We had the first ambulances basically, and then they went from horse-drawn to car, and then flying cars are next. So this is really going to change what your community will be. In my particular case, being in Miami and bilingual, et cetera, I've cultivated a community that is well beyond Miami, being the type of city it is. It's the Caribbean, Mexico, Central America, and South America. So I've focused a lot in my practice on actually that community. I can tell you I'm better known in Guayaquil than I am in South Beach, and I always kind of joke about that, but it really is true. I have a particular interest in the basal joint for arthroscopy for many years, but now the community of patients with basal joint OA often travel to me because patients don't want an LRTI. They now research it, and some may do it, but this is how I think patient-driven procedures may come to you. Uh, so locally, of course, I mean you have to start there, and the the you can do sort of local advertising or educating. In my case, what I did when I
There.
left the Miami Hand Center that I had co-founded 30 years ago,
Now I can
I
hear it through these earphones.
what's that? Excuse me?
You can continue. I think someone's just off mute.
Oh, okay, okay. Uh, so I started something called Ortho Now, and I think you're seeing this flourishing of orthopedic walk-in centers. So that may be a way in your own community to do that. Obviously, getting involved in business organizations with large employers, schools, sports teams, etc. All of these you can give talks, or you can use social media to target them, which is a lot easier than giving a talk, although it may not be quite as rewarding. Uh, and then focus on certain patients who are community leaders. I mean, we treat everybody the same medically, but I think we all know that when you're building or expanding your practice, if you spend a little bit, just a little more time with certain people who have access to other patients that may be referred to you, that is a worthwhile endeavor. So it's something to think about. The live surgery. This is something I just did this today. Uh, Sometimes I do it directly to schools. So obviously, all those kids have parents, and they talk about this. It's just my way of giving back, but it does help your practice grow. Um, Now, we all have a brand, right? And theoretically, it starts at birth, but it's going to distinguish you, the service you give, or products that you deliver to the community, whatever your community may be. And patients will see you as a brand. I mean, you can mold that. The best time, obviously, is when you first go into practice or you go into a new community, and you can sort of start fresh, but you can always mold it, and it's going to be reflective of your personality, right? Um, so you want to define what your goals and desires are, be consistent, and certainly stay in your lane. I realized a long time ago I'm not going to do a lot of brachial plexus, so I stopped doing that within 10 years of practice. But I am very interested in privatemia. So in my case, I'm independent private practice, but I like to publish papers and write chapters, et cetera. So that's something I like to do. There are other things I don't like to do, right? And the other thing is somehow along the way I fell onto this sort of being a healthcare disruptor, just because I think it's important for us to do it. So that's my own particular thing. Uh, Digitally, this is really how I think going forward, people are going to mold their reputation. You have to have an online presence. I mean, it's almost a must now. Um, and social media is only one component. So in my case, the website is to me the most important. I try to drive patients to the website rather than ask questions through social media or other routes. Um, Obviously, medical journals online, right? If you want to uh, further your reputation in terms of particular topic. Um, there are WhatsApp groups for I'm a member of 5 or 6 of them. Sometimes it's a bit overwhelming, but when you have a few moments, you can ask a question about a case you want some input on, or give your own input on a case, which is really rewarding. And there are patient focus groups even that you should know about. And then obviously, being all of us in hand surgery, being industry is an important part, and I don't think we should overlook that. So this will be covered actually. So there are some advantages, right? In social media, the disadvantages we should mention, right? It can be manipulated. You don't want to do something offensive, and it is permanent. So be very careful. I won't go into these because some of the other presenters will, but there's so many different platforms, and in your own community, it's probably important to be active in those. Um, and it's not just in your own practice, right? So your surgery center, your rehab. I happen to have a teaching lab that I founded, the Mark Institute. So there are all different facets of your practice in your community that you can use social media to help further educate. And then the personal, I every once in a while mix a little bit of personal. I think patients want to see that you're a person. But my teenage daughter doesn't let me do that very often. So, but it is fun to do that. So here's just some examples. Here's with the first and only president of the AMA was an orthopedic surgeon. It happens to be a fellow hand surgeon, right? Andy Gurman. So when he visited my center, and then if you're doing, I chair this annual course, and here's the faculty. So these are different ways. I mentioned the live surgeries. I'd like to show this because I think this is a kind of unique way that I build a brand. Hopefully you can hear the audio. Dr. Alejandro Badia announced a hashtag live surgery Tuesday for tomorrow, probably around 3 p.m. Miami time, where I'm going to be showing a very arthritic glenohumeral or shoulder joint. We're going to be doing a hemiarthroplasty, half joint replacement, but not a resurfacing. So I do a lot of resurfacing. So I was talking about this case where I didn't. And then just to give you an idea, what I did one today, by the way, it was a combined rotator cuff labral repair with a disposable scope. Uh, so people can ask questions about that. And believe it or not, patients will sometimes call in, the general public, and I think that's fine. So you want to speak on both levels, obviously. So here's an example of something I'm interested in: small joint arthroscopy. MCP arthroscopy is really underutilized. You just need a 1.9 scope. It can't be a regular wrist scope. The collateral ligament just looks really redundant and irregular and inflamed. These portals are so small that we don't even need to put a stitch in them. And he's a little bit lax. The loose joint, see? You've got a hyperextension at the NP joint. So right here it's very redundant. So I'm going to tighten it up there. Okay. So that is a way to maybe take some of the mystery out of surgery. I think that's important. But you want to combine that with a layperson explanation and more technical for your colleagues. So you want to utilize QR codes, right? You can put this on your business card. It just, even when you go to a meeting, just frankly, I haven't done that as of late, but I do put it on my business cards. I think it's best to just have it on your smartphone, but this way people can reach you easily. And on the homepage, you have to decide how accessible you're going to be. I pride myself on answering patients' questions myself. Not all of us may want to do that, and then I immediately bring in a staff member to help them with the logistics of scheduling an appointment. I do a lot of telemedicine. I didn't have time to mention much about that, but that's even in your own community. If traffic is bad, people appreciate that, and particularly for follow-ups. So that's something you want to think about. I feel strongly about this. I think all of us we need to collaborate more, and in doing that, I think it helps all of us. And in fact, all ships rise in a tide, right? So I think as we go forward, we have to realize where our challenges are, and they're not between us. As I say in my book, the competition started in organic chemistry, but at this point it should end, because we all can benefit working together. Uh, for those who don't know my book, I talk a little bit about this in some of the chapters in terms of private practice, but obviously the focus of the book is more exposing the issues we have. It's been an incredible challenge talking about raising all ships rising in a tide. Has been an incredible challenge to get this book even in the Hand Society. I mean, I'm not sure why that is, but if a member writes a book that has on an important topic, I think it'd be nice to be able to share that with folks. So that's a QR for that. If you're interested, there's about 4 or 5 Hand Society members and 2 association members who are contributors to the book. So I talk a lot about these strategies in the book. I think it's important to give that face to the community that we are never berate your colleagues and try to be supportive. And I think, as I said, all of us, all ships rise in a tide. Thank you very much.
Thank you so much. That's a nice overview, and I think a lot of us are aware of what you've done and what you've built. Before we go on to the next speaker, I wanted to ask you one question. So, for a young surgeon, or not even that young, I'm about 9 years out, and a lot of the social media stuff is pretty intimidating for me. I don't see myself doing online video. That's just not me. But I
Sure.
really like that slide where you put up the community efforts. You had a lot of different things there, Chamber of Commerce and connecting with leaders and whatnot. Is there one or two that you think are either underutilized, underappreciated, or maybe a kind of like surprising high yield? I've heard people say you can give talks at like senior centers or senior communities. I haven't really done that, or maybe an ad in some newspaper that maybe my generation wouldn't think anybody looks at, but it turns out it's actually really affordable and really effective. Anything that really stands out?
Well, it's funny you picked up on the chambers because there you're going to be able to make contacts with people in the business community. And you know what? If you market to say one person who happens to be in human resources of a big company, now you haven't marketed just one person, but they might have 300, 400 employees. I've been very involved with the school board. It's the biggest, probably in many towns, and maybe the biggest employer. Certainly in Miami-Dade County, it is the biggest employer. And so I've been taking care of those patients for decades now. And part of that is going to events. And I can tell you, you may be the only physician there, and that's great. So now, again, you're right, Oren. That may not be in line with somebody's personality. It might not enjoy that. I don't do much medical legal work, for example. I'm not good at it. So I realized a long time ago, I'm not going to do that. So I think you have to define what you like. Yeah, going to senior citizens is actually very good because they all have issues, right? And they tend to engage. So that I think that is a good strategy. And then certainly, I'm not a team doctor anywhere. As a hand guy, it doesn't make sense. But I do try to let the team doctors or the different athletic departments know that a hand and wrist specialist should really be involved because we know that a lot of times they don't get great care because the sports guy doesn't understand carpal instability. So I think that those are high yields.
Awesome. Thank you so much. And we'll have time for more questions after. All right. Thank you. So this is a perfect segue to Dr. Steve Niedermeyer. And the topic here is going to be advertising and marketing strategies.
Awesome. No spoilers.
Perfect. And you can start your video too if you want.
Oh, I thought I clicked it. All right, let me start that. And then do you guys see the good slides and
Yep.
not the cheating ones?
Now it looks good.
Okay, great. All right. Thanks to the panel and to AAHS for including me in this talk. I hope to make this talk fun and enlightening. I've learned a lot coming out of fellowship and into my first 5 years in practice about advertising and marketing, being a private practice surgeon in a very busy metroplex, and then switching jobs and going from kind of one advertising marketing strategy to another. So I'll give you a lot of my experiences and then hopefully have enough time for some questions. So these are my disclosures, not pertinent to this talk. One of the big things I did not realize, when you're a part of an academic center, they kind of make your little webpage for you, stick your CV on it and all your accolades, maybe a blurb about yourself. But when you go into private practice, or maybe even when you're in academics and they ask you, like, hey, we're making you a website, what do you want it to say? I had no idea what to do. So this is a video, and I'll pause it so I can kind of scroll through it. There are companies out there who will help you do this. This is a particular company, YPO, who you basically do just that. What do you want on your website? What do you want patients to see? And they kind of set it up for you. They make you a logo if you want a logo. But the big thing is, what do you want in your website? And I think the best things to put on your website is kind of what Dr. Badia said. What are your interests? What are your expertises? What do you want people when they Google carpal tunnel, cubital tunnel, shoulder replacement, Dallas, Texas? Do you want your name to pop up for those things? And so thinking about what kind of practice you want to develop, and what sort of pathologies you want to treat. I think that's the first and foremost. Secondly, and this is the kind of a two-pronged thing, you want to keep your CV on there so that way it's not just your CV on your website, it's a link to your PDF. But this also then motivates me to keep my CV updated. My first practice, we had our own website. I didn't have my own. And now that I have my own website, 6 months will go by and I'm like, oh man, I've got like 10 things I need to add so I can keep my website updated. So it kind of keeps me honest, keeping my CV updated. One of the things up here at the top is patient info. And so what I've placed here are the pathologies that I treat, with links to ortho info for those pathologies, the ASSH handouts. You don't have to reinvent the wheel, right? We have tons of opportunities to use what's already been given to us by our societies. And I just have links to those PDFs, but then I also have placed links to my post-operative protocols. Like, you guys see it all the time. You give them a packet, you spend so much time making these printouts, giving them the packet, and you show up to surgery and PACU calls you and like, hey, they have no discharge instructions. And you're like, I gave it to them in the office. Did they bring their folder? And they're like, no. So I'm just like, hey, go on the website. It's all still right there. It's probably buried under some snail mail and magazines on your kitchen counter. But this is a good place for patients to go. So that way they're not constantly bugging the office. They lost it. They're like, oh, I need a new printout. Just go onto my website. It's right there. But kind of scrolling down, highlighting again those certain things you want to do, you want patients to see, and you want search engine optimized. Because once these things go on your website and somebody searches it in your area, these are the things that'll pop up. Again, little blurbs about me. I'll talk about some of these top doctor honors in a couple more slides. I won't belabor it right now, but those can be a little frustrating. And then put your reviews on there. A lot of us have Google reviews or reviews on other different review based websites, but you can link those to your website so that way they can scroll through and see all the accolades that you or may not have gotten. Some information, watching videos about certain pathologies, about certain procedures, presentations you've done showing that you're published and you're out there and you're doing kind of the cool thing. And then links to any multimedia you might have out there. You might have a surgical technique video. Dr. Badia might have something he wants to put for CMC or MCP joint arthroscopy on there. And this is a nice way that they don't have to go to YouTube. It's all centered right on your website. So one of the biggest things is down here at the bottom. I have it also at the top, but down here at the bottom, whenever I get somebody who calls me like, hey, my mother-in-law will call me, somebody in my Bible study wants to get an appointment with you. I don't want to harangue my MA to put in all this patient information. So I've linked our website book appointment link to my website. So this will go right to my practice's website. They'll fill out all their information and they'll get called by our schedulers. And this is a great way to maximize a patient scheduling an appointment with you after they go to your website. You don't want them to go to your website and be like, oh man, I love Dr. Sahi. He looks great. And then they're like, all right, well, where do I book an appointment? And then they got to go back to Google. And by then the 30 seconds of attention is gone and you may or may not have lost that patient. So this is something, again, I kind of learned on the fly, but very important to maximize your digital presence with your own personal website. And then obviously to Google. Something I didn't manage in my first practice. And then when I left, my practice was like, here's your Google business profile, do with it what you will. And I'm like, there's a profile like that I have to manage. It's actually very, very comprehensive. You can put all that information that's on your website on here. You can organize your reviews. You can respond to reviews if you want to respond to reviews. But one of the big things is this Google Ads. Again, search engine optimization. I think there's another talk about it, so I won't really go into detail. But search engine optimization is huge. And when you're starting practice, or like, let's say, there's been a dip in your new patient volume and you're like, I want to get back out there, get my numbers back up. You'll see here next to the green dots, you can basically make any phrase for pathology or whatever you would like to see in your office and search engine optimize. It is at a cost depending on how fruitful you want the ROI to be. You can either have three or four little blurbs and a minimum payment, or something that can be as thousands of dollars a day. But when these people break their wrist at a urgent care and the person that they hook them up with can't see them for 4 weeks, they're going to go right to Google and say, "Hey, broken wrist." And if you've maximized your ads correctly, your name will come up. And you could basically do anything. Here, I've got elbow surgeon, Arlington, carpal tunnel syndrome, question mark, evidence-based medicine, my name, overhead athlete experts, things that I want patients to see and pop up when they're looking for hand surgery or upper extremity surgery pathologies in my area. Very, very useful. This took me like 2 or 3 weeks to really understand, because there's some advertising, marketing, econ 101 stuff in here that I'm like, what in the heck? And then I just open up another tab, hit Gemini, and I'm like, what are you doing here in Google Ads? Explain this to me at a fifth grade reading level. Reputation management systems. Google's probably the primary one. Just like Dr. Abadia said, you can get a QR code that sits on your checkout counter, just like your barbershop, and they can give you a QR code based Google review right before they hit their car. But then there's all these other ones: US News, Facebook, Yelp. I basically took this image from Google Images. I don't know. I didn't know Yelp was a thing. So when I saw this, I'm like, let me go on Yelp. And there's actually reviews for our practice on Yelp. I just thought it was like a restaurant and hotel thing for people who like got a cold burger to like blow off some steam. But this is actually a review website. I don't know how many people use it, but this is just an example of reputation management systems. And one of the things, again, that's frustrating is these top doctor ones, right? Like, who's doing this? Is it important? It's frustrating when you get these emails from your marketing team in your practice, like, hey, the top doctor awards are coming out. The top doctor awards are coming out. And I thought it was all BS. Mostly all of our partners would just vote for ourselves. We become top doctors of Fort Worth. And that was it. It had nothing to do with patient reviews. It had nothing to do with outcomes. It was just your colleagues and your peers voting for one another. But on the back end, I can't tell you how many patients come in and they're like, "You've been a top doctor of Fort Worth for 3 straight years." And I'm like, I guess. I'm not talking about, the top doctor stuff you see in the airport magazine when you're sitting in your seat and you take out the insert and it's got the top doctors, best plastic surgeons across the country, whatever. But locally based ones can actually be very, very important and impactful when patients are looking for quote unquote top doctors. I thought it was kind of a gimmick, but it can actually be very fruitful to have your name out there in those top doctor things locally. I won't go in too much into social media. I don't want to steal Dr. Galvez's thunder because he is phenomenal at social media, and I probably don't hold a candle to what he can do. But this is a growing area where patients are finding their doctors, and not just Instagram, but I mean, I consider YouTube to be social media. So surgical videos like this, like when I tried to search, best techniques for allograft AC joint reconstruction, there's an old video from Connecticut from about 10 years ago, and I'm like, man, somebody should really update this. And so educational micro content like this, or case storytelling. We all do a lot of Wallant carpal tunnel surgery. I still get a ton of people who come in, they got their carpal tunnel done even 5 years ago by somebody else, and they come in, and I haven't done an asleep carpal tunnel in so just carpal tunnel in years, and they're like, wait, I don't have to go to sleep. I can drive myself to and from. And so this is another good way to kind of get those informational pieces out there, like, oh, this is something that can be done. This is something I'm interested in, and an easy kind of 30-second little clip before somebody scrolls on to the next TikTok. And this is something I've kind of adopted more on the social media side, is the engaging, humorous but appropriate content. I'm sure we all saw that horrible news article or video that came out of those nurses who had been in a patient room and were posting pictures, taking pictures of a patient after they had left the room. That's not what you want to do with your humorous content. You want to make sure it's appropriate. You want to make sure it engages your target demographic. For me, these videos are for our colleagues, right? Residents that are coming up, young physicians that are on social media. Just to, we love our jobs. I love my job. I have so much fun doing what I do. And this is just a way for me to express myself that way. But then it also helps, when I go to conferences and I'll give a talk and I'll come off the podium and somebody be like, "Dude, I love your Instagram videos." It's that sort of engagement that can be just as important as outreach to your community. These are things I've done locally. This picture here in the center is a first assist CME course that I've done every year since I've been here. Before I had a PA, this company just has first assists for doctors who need a second set of hands. But they also organize this CME for reaccreditation for these employees every year. And so this gets me in front of a room full of first assists, and maybe they enjoyed my talk and they'll text me later and be like, "Hey, I have a patient, a friend that's in my neighborhood. They broke their wrist. They want to know who to see. Can you fit them in?" This one in the top right actually is a Chamber of Commerce luncheon. I had no idea what these were, but my practice was super involved in our community, and you can see all the top doctor accolades there in the bottom, how important those are. But this was a great way to get in front of small businesses and your community, like, "Hey, this is a hand surgeon in our area." That maybe, especially when I first came to this area, because I'm not from Dallas, Fort Worth originally, trying to get my name out there. This was great. Tons of small businesses. Give a quick 5 minute discussion on a pathology or on your practice, and instant referrals. The one down here at the bottom left is a free carpal tunnel screening that I've been giving about twice a year. You see this waiting room is packed. You think, "Oh, carpal tunnel? I don't need to go out and market carpal tunnel." But I do wide awake carpal tunnel, and I mean, so many of these people don't even know you could do this without general anesthesia. So again, something I want to be known for in my community, wide awake surgery with no tourniquet. Just invite these people into your practice, give them a quick talk, scan, ultrasound their wrist, let them know what the pathology is. And again, it's an instant referral base. And then these people tell other people and other people. My friend just went to the Texas Tech BYU Big 12 championship game, and the attendant in their suite had carpal tunnel surgery with me like 2 months ago. And she came to this screening session. And so it's a great way to get your name out there and set you apart from other people in your community. And down here, I've been giving a talk with our local physical therapy colleagues in the area as well. Again, they'll see somebody for shoulder pain. They're rehabbing their rotator cuff, and they're like, "You know what? My fingers have been going numb and tingly since that surgery." And it's like, "Oh, well, Dr. Niedermeyer came in 2 weeks ago and gave us a talk. Go ahead and see him." So all these outreach events and educational events can be very beneficial. And this is kind of the classic one, right? Going to urgent cares, bringing them Panera, dropping off some cards, going to your PCPs in the area. "Hey, I'm new. This is what I do." But I think that second part of what I said is the most important. Letting them know what you do. I'm a hand surgeon, but I operate shoulder to fingertip, and not a lot of people know that. And so I'll get a referral from a PCP for carpal tunnel, and somebody will be like, "Do you do shoulders? Do you do elbows?" I'm like, "Yeah, I do it all." And it's good to have the knowledge from the referral source that, "Hey, yeah, Dr. Niedermeyer can do your shoulder pain and your hand pain at the same time," or whatever your expertise may be. But going and basically telling them what you do, as opposed to just dropping some cards and being like, "Hey, I'm new in the area. Here's some donuts. I'm getting out of here." Let them know what you're there for. Let them know what you can provide. And then obviously taking call. And everybody hates call, but it's a good way for you to get your name out there, interacting with the ED staff, interacting with the PAs that see most of the hand stuff. I don't know about you guys, but I feel like no doctors want to see hand stuff when they call me. It's always the PAs and the nurse pracs that call me, which is fine because then they give me all the referrals for when they come in because they know me by name. And so a great way to expand your referrals by interacting with other physicians and primary care providers in the area. This is something new that my practice has been doing a lot of, and I think, I mean, if you go to ASSH, we'll be giving a talk about this, a pre-course. But these employer direct contracting and these specialty care platforms. So the employer direct contracting is setting yourself up. So we have a employer direct contract with the Mansfield Police Department and Fire Department. So whenever they have an orthopedic problem that happens on the job, we get that patient directly. And same thing, my old practice, it was with Lockheed Martin. A ton of these Lockheed Martin employees would come right to our office through this employer direct system. And this could be a great way to expand your referral network, right? It doesn't have to be just the Lockheed employee. The Lockheed employee probably has a family, and that family member is probably going to need a hand surgeon sooner or later. But this also helps with reimbursement. These employer direct contracting contracts can be very lucrative and increase your bottom line as well. And these specialty care platforms, I had no idea what this was until I got into my second practice, but we're part of a thing called, it goes by many names, Surgery Plus, Lantern. But what it does, it brings your name into a certain subset of like insurance riders. So these people that have Lantern will look, the insurance company will tell them they won't even know they have Lantern, and they'll go to an orthopedic surgeon and they'll get set up for carpal tunnel, and then they'll get notified like, hey, by the way, you have Lantern. If you go to this provider who is a Lantern surgeon, your surgery's covered. And so, boom, you just grab another patient that was going to have surgery with somebody else by just simply signing up for some of these extra insurance riders that are both lucrative to your bottom line, but do set you apart. I think there's only 3 hand surgeons in the entirety of DFW that are part of this Lantern program, and I do about 15 to 20 of these surgeries a month. And they're already surgical patients. They don't get referred to you unless they need or are considering surgery. So it's been very beneficial, and again, is a way to kind of set yourself apart. So in conclusion, a digital presence super important. It's the way everybody's going. Even your Medicare patients are going online and looking for surgeons. So make sure that first impression on your website or your practice's website or your university's website is up to date, full of information, and highlighting the pathologies that you want to see. These paid ads on Google, I can't speak enough about the ROI that you can get with a well-crafted, well-molded, directed, personal ad campaign for you. And Google will track it for you. How many of clicks resulted in links to your website, and then your website will track how many clicks on your website led to patient appointments. So it's a good way to know your outcomes when you do spend the money to do those paid ads. Referral systems gives you predictable volume, but also educating the people sending you those referrals is super important. Letting them know what pathologies you want to see, what parts of the body you're interested. Are you a nerve surgeon? Are you not? So that way, when you get these referrals, they're not, oh, you do shoulders too. Their patients are well educated. And then capitalizing on your brand identity, it gets long-term trust and patient loyalty. And again, the biggest referral base we have are the successful patients that we treat after the fact. Those, all the Googles and TikToks and Instagrams and YouTubes, word of mouth referral, bar none, is the strongest referral that we have in medicine. And the best way to do that is to give yourself a good first impression before you see your patients.
That's great.
Thank you, guys.
Thank you so much. Very comprehensive. And I loved all the examples you gave. Certainly a lot to think about. I know I was taking notes on that. For the sake of time, I'm going to move on here and then we'll get to some questions after. So now we will hear from Dan London talking about soliciting and managing patient reviews.
Thanks, Oren, and thanks for the invitation to present today. So I'm Dan London. I'm a hand surgeon at the University of Missouri. These are my disclosures, none of which are relevant to this topic. And so we'll quickly talk about why these reviews matter, although Dr. Nina Meyer and Dr. Padilla have kind of hit this already. A little bit about where they exist, how to ask, a little bit about data specifically regarding hand surgery and some of my own experiences with this. So why do they matter? Well, they matter because they're the first thing people are going to see when they Google you. We've talked a little bit already about Google search results. This is me just typing my name in. I did this in incognito mode of Chrome, so this is with no cookies, so hopefully no tracking history to impact the results. And you see my practices page at Mizzou is the top hit, but then the second one's a review site with health grades. Google's got their reviews focused in the upper right corner, and then as you would continue down that first page, Yelp would show up on that first page, as would Facebook. So these matter because this is what people see when they hunt for your name or maybe hunt for hand surgeon in whatever town you're located at. So where do these reviews exist? Well, they exist in several different places. Some of us, especially at larger academic institutions, may have reviews existing on our own practice pages. So these were some institutions that I've got friends and colleagues at, and I've Googled their names, and they've got reviews. University of Missouri is not one of these institutions. We do not employ this. But a lot of these do, and that one nice thing about that is you don't need to really do anything if your own practice is managing the review process. They also exist at these third-party websites and kind of aggregators, so to speak. So this is Healthgrades, US News, Vitals, WebMD. This is where patients can leave reviews. They don't need to leave any identifying information, and this can be managed in different ways. And then they also exist at these more general websites, right? So Google is kind of an all-comer, but definitely can be a review source. Facebook pages, if you have a professional page, or your practice has a professional page, is also a place where reviews can be left, and the old standby Yelp. But there's one other place reviews exist as well, and those are your insurance companies. And so this can impact you as an individual patient if you are hunting for an in-network provider because you want to make sure you're limiting what your copays may be or make sure your deductible applies. So me personally, our health insurance is through United Healthcare. So if I go on United Healthcare's Find a Physician website when I log in, they will then take data from vitals and from health grades and import it and associate it with the different physicians. And so this will then be tabbed for if people are trying to find you as an in-network provider. So realize that this information does have crosstalk elsewhere. So how to ask for those referrals? Well, if you are an individual whose institution does this automatically, you don't really need to. Your patients are most likely going to be sent an email with an ask to send to review, and then that will automatically populate your website. This will probably be your number one hit on Google, will be your practice page, and then you'll see that you have 545 ratings and 50 reviews that can, impact your patient referral process. But what if you're an institution like myself or in private practice where that's not an option? What can you do? Well, some of us within the ortho department at Mizzou got a little frustrated with this, and so tried to come up with some cheap, easy solutions. And so there is some cost behind this, but it is relatively cheap. And we made these 5x7 cards. So the front page is an old profile picture of mine, and just a thank you to hand to patients, with the back being a QR code to leave a review. We chose to focus purely on Google for this, simply because that tends to be the number one search engine, and Google is going to prioritize their own results. But this is an option that literally just costs them money to print to have this happen. There's another option that I've been employing personally that is even cheaper because it's free, and that's utilizing RedCap. So RedCap is a kind of research domain and setup that you can use to collect research data or surveys, but it doesn't need to be used for research. It can be used, frankly, for any process, and it doesn't need to be RedCap. You can use any other kind of survey software, such as SurveyMonkey or Google Forms, what have you. And so what I do is I collect all my patient emails for those patients I've seen in the last week, and they get sent out this email automatically with a second reminder to fill it out with links to submit a review via Google, Facebook, Healthgrades, WebMD, Vitals, what have you. This goes to their inbox. This does seem to work a little better, at least in my community. I think most of my patients end up losing their QR code handouts when we hand them out. And they also get handed these things differently. I don't hand the thank you card until I discharge a patient. And so that number of times that they get seen with that is less, versus this gets sent out to every patient after every visit. And so just a slightly different frequency and cadence that can impact how people respond. Now, if you want to spend big dollars, you can look into, as an individual or your practice, all these different companies. I will point out that the top left one, Surgery Survey, is Oren Franco's company. So I don't know if it's quite as expensive as some of the others. And he has some grant money to get people to enroll for free. So you should reach out to him if you're interested. But these companies have a focus on reaching out to patients, but also managing the feedback that you get so that they kind of downplay the negative reviews and put an additional focus on the positive reviews. But this is definitely more costly compared to some of the other options I've mentioned. And what do the data say about hand surgery and reviews? Well, there's not a lot out there. These are the only 4 articles I could find that are hand surgery specific on this realm. There's lots of other articles if you broaden your search terms. And 2 were published in 2016, 2017. This was more about just who is getting reviewed and to what extent. And they saw for hand surgeons, the average number of reviews ranged from 9 to 14, with an average rating of about 8 out of 10. Positive comments tended to focus on surgeons' competence as a surgeon, while negative comments focus much more on the communication, surgeons' availability, and their staff. The more recent data from 2025 actually had the same emphasis, which was on the low reviews, the 1-star reviews, and what the common themes existed within those. So interestingly, most of them are from people you've never done surgery on. So these are people maybe you thought weren't a good surgical candidate. I have one of those on my own. And so some of those patients that maybe you turn away from surgery tend to be those that may get upset. Bedside manner is the most frequent complaint that is often cited. And so how we interact with our patients is paramount always. And then other problems like wait time, the time that the patients actually spent with the surgeon, and staff complaints we're seeing. If the complaint was surgical and clinically related, it tended to be about a poor surgical outcome or unclear treatment plans, misdiagnoses, and need for additional surgery. So how to deal with negative reviews? I think the important thing is to not get into a fight. You can't take it personally. You need to give yourself a period to cool off if you get frustrated or upset by this, and just kind of let it be. But it's important to acknowledge and validate the feedback, and not to be generic. Dr. Badia made a comment in the chat box earlier that he thinks it's important to respond to all reviews, positive and negative. That seems to be the suggestion that I saw as I researched this topic. But you have to make sure you stay HIPAA compliant. So you don't want to be generic with your response, but you don't want to indicate anything about the patient's individual care, and always offer the opportunity to respond privately, either reaching out to the patient or asking them to call the office to be reevaluated or have their concern addressed. Most importantly, do not ask for the review to be removed. That is just inappropriate and can get you in a lot of legal trouble. My other thought on how to deal with negative reviews is to actually flood the system with positives. And so that's where these different strategies for soliciting for feedback and soliciting for reviews for your patients can be helpful, so that you try to drown out that one-star review with 10 to 20 5-star reviews to balance out the scores and to just shift the attention. So from my own anecdotal experience with these, the hardest step, and this is very hard for me to do personally, is simply asking your patients to leave a review. While I hand them that card that I showed earlier, I don't necessarily say, oh, and please leave a review about your experience with care with me. I just hand them the review card, hand them my business card, and say, reach out if they need anything, because I'm discharging them from care. That's probably not the best approach. I think you simply just need to ask, and that sometimes can feel a little off-putting and challenging to do, but it's an important step. I think for patients, logging in and leaving their names can be a hindrance. So that's one negative with Google. Patients' names, or whatever the name of the profile that logs in and leaves the review, that's documented. And so if it's Steve Smith, everyone can see that Steve Smith left a review, which meant that Steve Smith was treated by you. I think some of the other websites like Vitals, Healthgrades, WebMD, et cetera, those can be left anonymously. And so in that context, it may be better for some patients to leave reviews there for that reason. The exact response to negative reviews is still elusive, although we did talk about some of the recommendations that are here. But I think the most important thing is to not take it personally, and continue to take care of people is the best way possible. And as I mentioned before, trying to flood the system to kind of quiet down that one patient that maybe is not happy with the experience. So thank you for allowing me the opportunity to speak, and happy to take any questions.
That's great, Dan. This is certainly an area of interest of mine, and it has been for about 10 years. And I would just emphasize pretty much everything you said. I think Google's definitely number one. You expressed that the cards aren't as effective as your automated emails. I think the data that we have clearly shows that any form of automation is better than non-automated. And in general, you get a 1% response rate to cards, about a 5% response rate to emails, and about an 8 to 10% response rate to text messages. So that's kind of the next level. And that's what a lot of the services, including mine, will help you do. I love flooding the reviews. What we like to say is the solution to pollution is dilution. That's really the best way to go. The one data point, I have a study that was never published where I actually looked at every single hand surgeon's ratings. And what's very, very clear is the more reviews you have, the higher the score. And the reason for that is obvious. You will only get a lot of reviews if you have a system to ask patients. And if you don't have a system to ask patients, then you will be left to receive reviews from the ones who choose to do so. And the patients who choose to review you will be your unhappy ones. So if you do nothing, unhappy patients will leave you bad reviews. And if you do something, you will capture more of the happy patients. So the more reviews they have, the higher the score. But thank you. That was great. And now we're going to move on to our last talk. This is Dr. Galvez talking about creating a social media presence, which I'm certainly eager to hear about because I don't have one.
Thank you so much. Can you hear me?
Yes.
Yes.
Perfect. So, thank you for the opportunity to present. I definitely appreciated everyone's talks. It really is, hearing everybody has different practice types, and it's just interesting. We all live. I live in I live in a pediatric world in a pediatric hospital, and so
Scharfenberger and
there
Hubbard.
are. I'm going to keep going. So there are, just differences in how we practice and whether it's private, and just listening to these different things, from, peer nominations for top doctors or dealing with these with reviews, I think is so important because it all paints a picture for patients. And that really is the most important thing. And this is a study that's incoming is like, who is a pediatric cancer surgeon, right? Very basic question, that for patients, it's hard when you Google and when you go online and when you go through social media, you think it's an easy thing, but we have all these systems and silos that are built. And what we're trying to do is just navigate them and trying to figure out and meet patients where they're at. And so I don't have any conflicts of interest. And this is just what I was talking about is you go where the humans are, and that's where social
Yeah.
media has become that place. It's important, right? We take care of people, we take care of humans, we want patients to have care. And so we want them to know that we're there. We want them to know that we're available in their community, that we can provide high level of care for them. How many times have we heard of people that's saying, "Oh, a hand surgeon? I didn't even know that existed," right? How many, it's very common, right? And so the more awareness that we create about our subspecialty, the more care patients can get, the better access hopefully they can get. So in regards to social media, when you create a presence, and I'll talk about the benefits of that, but what you're trying to do is create you in this environment, in a digital environment. And talked about websites and reviews. And similarly, to create a presence, it's posting on social media, and that means creating videos, or creating photo content. And so there are many platforms to choose, and just right, we look at artificial intelligence, things have changed 3 or 4 times just this year, right? It's hard to even keep up. Similarly, with social media, there are some that have been persistently there, like Facebook. There are some that are gone, right? Twitter is gone for especially for patients. There's LinkedIn has come up, right? It's like a race and try to figure out which one is the most popular to use and the most appropriate to use, TikTok being another. And so the goal is to find out where the patients are and to let them know your subspecialty, to let them know that you're there to take care of complex hand problems. And as mentioned, it can help build your practice. I think in regards to the
And
presence, just as mentioned, like
can't
just
see your
mentioned
slides, Mike.
that. What's that?
We can't see your slides.
Oh, really? Huh.
Yeah. Sorry.
Oh, okay. Sorry, I didn't hear that at all. Thank you. Well, a lot of what I was saying was okay. Sorry about that. I hit the share, but I don't know why I didn't go. Okay, so in regards to presence, it is important to have a goal of what you want to attain, right? Everything that we do in life and what we do in our practice, everything has risks, benefits, and alternatives, right? And so when you're creating a social media presence, you really want to think about what's your goal? What are you trying to achieve? And that goal is different for everybody, right? It's what you care about in your field, whether it's, for me, it's education and advocacy. I would say that's probably the most important thing that I like. But for everybody in our practice, it's different. So it can be education in regarding patient care and hand surgery. It can be in academics. You may want to create the awareness of your practice. Um, and so the benefits are that you can build trust prior to patients showing up to clinic. You can highlight some of the work that you're doing. And from the academic aspect, you can highlight your research. And so what I do in my practice is I simply have a hand Instagram account. And I really enjoy this because I get to create content and the things that we do in my practice. And when patients show up, I show them videos about what we're talking about. Hey, you have a ganglion. Take a look at this post. This is relevant to the care that you're going to create, or a pulsization. I have one in English and in Spanish. Here is what to expect before, after, and then in the recovery for such an operation. And so just showing these contents of before and afters, I'm a huge advocate for photography. For myself, I'd like to use a separate camera. I don't use my phone. I don't like having my phone full of different photos, figuring out who my family is and what family photos and what surgical photos. I keep things separate, but I highly recommend taking photos before and after. It really helps paint the picture when you're explaining to patients and their families. And that is how you create your brand too, right? And showing the work that you perform, like for an amniotic band release, for fixing a thumb duplication that's curved and having to fuse it, or fixing a complex collateral ligament, and then having fun in the process. And as mentioned before, you can make things fun. A kid that after I did surgery, he beat me in arm wrestling. But the visual component of hand surgery is so powerful. A patient with cerebral palsy before and after fusing a wrist, or a patient who wasn't able to hold things before, this is rare, but fusing their wrist and now and doing lengthening their flexor tendons and shortening their extensor tendons, and then having them use it, and taking videos and photos, and obviously with patient permission. You can hire people to take video of you also, but having stories that are produced or can be helpful. I'm blessed to work in a pediatric hospital, but telling the story of a kid with Madelung, showing the before and after, showing the complexity of Madelung. I'm going to skip this, but you can look at that on social media. But showing a before and after of cases, I think, are so powerful. Overall, in regards to professionalism, you have to be professional. Your presence online is what people will look at. You should be strictly adhering to HIPAA and your institutional policies. I take an educational approach, clear boundaries of never providing individualized medical advice on social media, and it's an extension of your of your clinical presence. And so tips and tricks for this presence. You just have to start practicing. You can start with taking videos of yourself. It helps with your ability to communicate, to convey messages of even when you talk to patients. And then you want to be consistent. You want to be authentic. You want to start slow. Just start with one or two platforms. AI is powerful. You can use that, but be careful. You don't want to go into where you can clearly see that the content has been produced by AI. And then you can hire help with social media, but sometimes that's not as personable. I think it's better to make it fun for you and your practice and why you do it. For me, the Valley Children's Hands is because I find it fun. I want to show families what to expect. You should never buy followers when you're trying to gain your engagement. This takes time and practice. This is your own time. You want to make sure that it's worthwhile. And you're also one person sometimes when you're producing some of this content. So you'll only have so much bandwidth. So be very selective in what you choose to spend your time. But that's pretty much it. You have these content strategies. You can focus on education, case base, outreach, as mentioned, storytelling. And then as far as the tangibles, like I've had patients travel from 4 or 5 hours away because of a specific skin graft type that I use. Just these little subtleties that some patients will want to go above and beyond to find the right surgeon, right? Similarly, when you create a social media presence, they can kind of get a feel of who you are and what you care about. And I have patients bring up like the advocacy work stuff that I do, which is not, what something I want to bring into the clinical setting, but they bring it up and I'm like, oh, that's cool. Thank you for following. And then I go, back to I'm a hand surgeon. We're taking care of your hand surgery problem. But sometimes you do have to be mindful of the presence that you have created. And so that's pretty much it. I wanted to talk about the referral impacts that can happen when you're on social media. And so thank you so much. I don't want to go over because I know we're a little bit over time.
Thank you. That was great. First, a quick question that just came through the chat. Do you have all patients sign a waiver, even if there's no identifying information in an X-ray or a photo of a hand?
I do. I do. I have, I have them sign a photo consent.
Yeah.
Exactly.
Okay.
And even when I use x-rays, even if it's de-identifying, I do have them sign a photo consent.
Got it.
Yeah.
If there are any other questions, please post it in the chat. My one other question for you is, and this kind of links back to Dr. Badia's what he was talking about, is like your community or your area in today's world is international. It's the whole world, right? People will travel and it's so easy to communicate. When you get on social media, recognizing your reach can literally be infinite, are you finding that it's connecting with your local patients as well? Or is this giving you a national platform and pulling in patients from elsewhere?
Yeah, I think that's why that's why it's so important to figure out what you yourself care about. And for myself, like I said, I know I'm not creating this like amazing, growing, expanding social media empire locally. I'm literally like making a video on social media and showing it to my patient and saying, "Hey, take a look at this for later. And we can talk about it when you come back. Did you look at that pulsation video? What do you think?" So I find it very locally satisfying in how I use social media in my practice. But as far as like the impact, I would say it's less so locally, like right where I am in the patient population I serve. It does get me referrals from outside of our local area. And just like I said, those patients, they have to travel, they're more likely to have insurance. There are different those patients are different, right? They're looking for different things in regards to their care. And then I agree with you, like on the international perspective, also when you post things, there is, you do get engagement. For me, it's mostly engagement with other surgeons and not patients, I would say.
Oh, that was actually going to be my follow-up question is how much time is, I don't want to say wasted because it's still valuable and many of us enjoy engaging with patients and surgeons, but perhaps not, productive for your clinical practice. Maybe you just enjoy it, but how many messages are you getting from patients who are never going to treat with you, but they do take time to respond to?
Yeah, you do get a lot of questions from patients from other countries, from like Ukraine, like a year ago. There's just like you do get patient questions. At least for me, through my social media, like it tends to get pretty well hidden. Patient, the profiles, it doesn't light up as like a first message I should see. So unfortunately, a lot of those messages kind of get hidden. But it does happen. It does happen where you do get international patients who try to reach out for
Yeah,
care. Yeah.
that's great. Thank you.
Well, I think that takes us to the end of the webinar. Thank you all for sticking with us a few minutes late. Really, thank you to all of our speakers and our moderators. It's a really wonderful session. The recording of this webinar will be up shortly on the AAHS website. There are a variety of other webinars that are coming up, so please stay tuned to your inboxes. The AAHS annual meeting is coming up in January outside of San Diego. That'd be a great time to meet with all of you. But thank you again to our panelists, our moderator, and to Dr. Warren and Dr. Jane. And I wish you all a pleasant evening. Take care.
Thank you.
Thank you so much. Have a great night.
Thanks, you guys.